Hello, everybody. Welcome to another episode of WESTalks. Let's advance. There we go. So WESTalks is brought together by IC Impacts and the UBC Future Waters groups. The organizing committee, as always, Abhishek, Jaskran, Fuhar, Furia, and myself. And here's a look at the fall 2020 lineup. We're now well into that. We're on October 22nd, in case you didn't check your watch when you woke up this morning. And it's Dr. Susan Murcott from MIT. And the title of today's presentation is Reimagining Engineering in Service and Populations Vulnerable to Wash, Climate, and Planetary Health Impacts. Quick note, all the previous WESTalks are available on YouTube. So if you go to the IC Impacts channel on YouTube, and then the search box is cut off here, but just search WESTalks and they'll come up. All right, now today's speaker. Dr. Susan Murcott is an innovator, entrepreneur, and lecturer at MIT. She has held various research and teaching positions in the MIT Civil and Environmental Engineering Department, the Department of Urban Studies and Planning, and today she's based in D-Lab, a program at MIT that advances collaborative approaches and practical solutions to global poverty. She currently teaches two courses, the first one being D-Lab, Water, Sanitation, and Hygiene, and the second is D-Lab, Water, Climate Change, and Health. She has an impressive record of water, wastewater, and public health engineering interventions in over 25 countries. Susan is well known for mentoring students and designing solutions for low-income communities, as well as in humanitarian disaster settings. And she is currently the co-PI of the 2018 to 2020 project that is titled Manufacturing and Marketing of E. coli Test Kits in Nepal, and the PI of a new project extending the same work into India with support from the MIT JWAFs.
That's right.
Okay, and with that, I'll hand it over, and a reminder that you can add any questions you have into the chat box, and we'll get to those at the end of the presentation. So at any point, just feel free to type them in, and we'll get to those at the end. Okay, so Susan, you can go ahead and share again. Hopefully this works.
Hopefully it does. How are we doing?
Looks good. Yep.
Okay, and let's make sure it can advance. Oh dear, it can't. It's not advancing. So I'm going to stop share and do that again. So I'm going to hit in the middle of the screen, of the green share screen. And I am.
So, the other thing I realized, once you share screen, you actually have to just click anywhere on the screen.
Oh, okay.
Because if you click on the Zoom box or anything, then you're like on the Zoom screen, not on your PowerPoint screen. So anyway, so now click.
Oh, okay. So this going now, right? It's advancing.
Yep, looks good. All right, I'm going to mute myself and let you take the reins here.
Okay, thank you. Thank you for your patience, everyone. I want to start by acknowledging Professor Young-Ho Lee, who invited me to this series originally, and he was my former student back a decade or more ago. And also appreciate Fur and Abhishek's role in helping me get here today. I'm going to speak to you. It's a rather long title, but it's what I'm kind of working on as we speak, reimagining engineering in service to people vulnerable to WASH, water, sanitation, hygiene, climate change, and planetary health impacts. So we've got a kind of full program here, folks. Hold on to your seats. And I wanted to begin by saying that I've had the privilege of coming twice now in the last several years, starting in 2015, to Vancouver and British Columbia, yay. And in fact, I was at British Columbia initially at the UBC for the 7th conference on engineering education for sustainable development. And that I was the invited guest of colleagues from Cambridge University, where I taught for 3 semesters, and who were collaborators in setting up this conference series with the UBC. And I had a wonderful experience there, and I actually presented 2 papers, this one called MIT Ideas Global Challenge and Lessons in Mentoring Transdisciplinarity and Real-World Engineering. And I'm happy to say it resides in your open library today. So this URL will take you to it. I'm happy to, you'll have my talk and the PowerPoint slides when this is over, and you can look at these two presentations if you're interested. This was the second one. I also had the amazing experience of coming after I was at the University of British Columbia, and I stood on your campus and looked north at the mountains. I thought it was the most beautiful place I'd ever seen in my life. And I thought, I have to bring my husband back here. Lo and behold, last summer, my husband and I were able to, with some friends, go out on this Zodiac expedition in Haida Gwaii, which is an island north of Vancouver Island. And if any of you ever get to go there, it is like the view from your campus, one of the most beautiful places on earth. And I just wanted to recommend it to you, okay? This is another view of Haida Gwaii. So the outline of today's talk are what are WASH, climate change, and planetary health impacts, and why do we care? My career, Reimagining engineering education, or engineering in service to vulnerable people, and some of my students' careers in the same. So WASH stands for Water, Sanitation, and Hygiene, and it's commonly considered by breaking it down into 4 elements. The water side, which is further subdivided into water supply and water treatment, which are often 2 different subfields within water engineering. Sanitation, hygiene, and environment, all right? And local and national WASH impacts were addressed originally by what were called sanitary engineers, beginning in the 19th century. And MIT's first woman graduate, Ellen Swallow Richards, was or even the founder of this field of sanitary engineering in the United States. So she's one of my heroes. And fast forward to today, all of us in this Zoom room are water rich because we get our water from the tap, as opposed to from unsafe sources like these women who are accessing water from the Bagmati River in Kathmandu in this slide on the right, this picture on the right. And similarly, we are the privileged in this world who are sanitation rich with flush toilets, as opposed to these kids in the Mumbai slums that are swimming in the wastewater from the latrines at that slum as their play as children. I'm assuming you're all familiar with the Sustainable Development Goals, and the 6th goal is the Clean Water and Sanitation Goal, and the indicator for that is populations using so-called safely managed drinking water. And so, how many people in the world lack safely managed drinking water? Anybody want to type into the chat a number? And that's defined as located on the premises, available when needed, and free from contamination. Can somebody, Carl or Abhishek, read off some of the numbers that are in the chat?
Yeah, we're getting somewhere around 2 billion, 2.1, 25 billions, 2 billion.
Yeah, good. Everybody's done very well.
And their homework.
Yeah, so I have 2.5. It's a little bit dependent on whether you use the 2019 or 2017 global population, but it's around 1/3 of humanity, 1/3, all right? So a pretty big number. And again, type into the chat, how many people lack safely managed sanitation services? You all got the first one right, so I figure you'll probably get this one right too. And read off a few of those, please.
4 billion.
Yep, that's
3
good
billion.
enough. Yeah, 4 billion. So I have 4.4 billion and about 60% of humanity. So again, huge numbers, all right? And if those numbers dwarf the number of people who are in water and wastewater engineering in the world, believe me. So we need a lot more people dedicated to this field. And then how many people lack hygiene, the basic hand washing facilities? And this number is pretty hot off the press. It's 60% of humanity. So that's 4.7 billion lacking safely managed, I mean to say safely managed hygiene. And why do we care? We care because of infectious diseases. Infectious diseases are in low-income countries are 5 of the top 10 causes of sickness and death. And those 5 are lower respiratory illnesses, diarrheal disease, HIV, AIDS, tuberculosis, and malaria. And we care about WASH because it plays a major role in reducing and preventing infectious diseases. Of course, we're all familiar with how hand washing suddenly jumped up as an important thing in our privileged worlds when COVID struck. And speaking of COVID, the fact of sanitary engineering or WASH engineering has greatly changed the situation over the last 120 years. These statistics are on Americans dying from infectious diseases, and you can see that life expectancy in the US was 47 years in 1900. It was 76 years in 2000. And it's changed in that period from infectious diseases being the leading causes of death to chronic diseases like heart disease, cancer, and stroke being leading causes of death. But with COVID being now the 3rd leading cause of death in 2020, we're kind of going backwards in terms of infectious diseases impacting the entire world. Shifting then to climate change science and its impacts, these were just addressed at MIT by Professor Jewel Carney in 1976. And there is a famous report called the Carney Report, in which he linked CO2 emissions to climate change. And he predicted that there would be a 3-degree rise in 3 degrees C rise in global temperature with a probable error of 1.5 degrees C. And this is close to what we know as fact today. In his 1979 report, the atmospheric CO2 was 335 ppm, and today it's 2020. So clearly he didn't get the word out enough, but it was a start, all right. Oh, now I am having this situation of my slide not advancing. So the impact of climate change on human health, if we look at the center of this circle, we see the well-known impacts of climate change, the increase in global CO2 levels, and then the rising temperatures, more extreme weather, which 2020 has certainly been remarkable for, and sea level rise. And then if we go on to the outer level of the circles, we see the CO2 rising levels impacting forced migrations, civil conflict, such as in Syria, extreme heat, illnesses and death, severe weather causing injuries and fatalities, air pollution causing asthma and cardiovascular diseases, changes in vector ecology leading to increases in malaria, dengue, and other infectious diseases, and water impacts on cholera outbreaks and other harmful pathogens in water. So what is planetary health? In 2015, the Rockefeller Foundation and Lancet launched the Rockefeller-Lancet Commission on Planetary Health. And they defined planetary health as the health of human civilization and the state of natural systems on which it depends. We'll take up this complex planetary health topic first by considering the simpler in quotes, challenge of human health and how do we measure that. So health professionals regularly check patients' vital signs, and they take measurements of the human body's most basic functions, such as the body temperature or pulse rate, respiration rate, blood pressure, height, and weight. Additional parameters include many others, but comprehensive metabolic panel is one. And these vital signs fall within very precise ranges. So for example, human body temperature, typical for an adult, is between 97 to 99 degrees Fahrenheit. And a body temperature that's higher than that range is in fever, and a body temperature too low is in hypothermia. And either extreme is a medical emergency. Similarly, in this chart is an example of a healthy individual. In the center column shows that healthy individual's value. And what you can see if you take, say, sodium, is that the 143 of the value of this patient is within the range of 136 to 145 micromoles per liter. Or if you take calcium, 7.7 grams per deciliter is within the healthy range of 6.1 to 1.8. So health is defined as sort of falling within a healthy range. And similarly, if you take this example of a person with cancer, this person happens to be in remission, and it shows just 1 month of their results. You can see that in the middle column, there's some examples like total protein that's low for this patient, or the kappa or lambda, which are high, and they're not falling within the healthy range. And doctors and other medical professionals use that data on a monthly basis to help keep the patient alive, all right? And so you can see the importance of kind of understanding the vital signs and the range. And so now we can turn to planetary boundaries. I'm not sure if this is a new concept to you, or if it's something you're familiar with and have studied. Has anyone studied this? Type into their chat box. Yes, yes, great, all right. So this is a concept that has been emerging in the last decade, and it comes out of the Stockholm Resilience Center, and it's an attempt to define the vital signs of the planet. And it has 9 categories you can see here: climate change, and so forth, ocean acidification, land system changes. And there is a safe zone, which is represented by the green circle in the middle. There's uncertain territory, which is the yellow. And then there's a high risk zone, which is the red. And the darker gray circle at the end of the green and at the end of the outside of the yellow is basically trying to set those boundaries that you can think of as similar to the ranges of a healthy individual based on the parameters that we saw earlier. And so by their reckoning, biosphere integrity and biogeochemical flows, and also the climate change and land system change are outside or nearing outside of the range of planetary health. And I also wanted to alert you to, oh, I guess I haven't put it in here, but yeah, no, I haven't put it in here, but it's somewhere. The article that I'd like you to read when you get the chance in your free time on planetary health. So planetary health is an emerging complex field combining Earth system science, climate change science, ecosystems ecology, politics and policy, sociology, anthropology, economics, ethics, humanities, and much more. And we urgently need trained professionals to take up this new transdisciplinary field. So why do we care about WASH impacts, climate change impacts, planetary health impacts? I'm going to take a minute and just let each of you into the chat like it currently is. We have 11 answers so far. Does everybody have the ability to maybe.
People there.
Yeah.
27 right now.
Okay, cool.
Here, we're getting some answers. I'll read a couple of here. Because we borrowed Earth from our children, not inherited from our ancestors.
I love it.
Public health and resiliency, human health and biodiversity loss. It's a basic human right.
Definitely.
Want to limit pollution for future generations.
Yes, so this is your work ahead, folks. Makes me cry, actually. So now I'm going to talk and keep writing in your answers. I'll compile it and kind of rework it into the presentation at the end of the hour. So I'm now going to talk a little bit about my career, just a little bit, and then my students' careers. So through my 30+ year affiliation with MIT, my students and I have engaged in public health and WASH engineering projects around the world. This map is actually from the kitchen of my parents' kitchen. And they were so proud of wherever I was going that every time I'd go to a new country, they'd stick a Post-it note on that country and rave about it to their friends. And I owe my water engineering career at MIT to the commitment and caring of Professor Donald Harleman, who was my graduate thesis advisor and mentor for over 15 years. And he taught at MIT for over 50 years, and he was really sharp, much sharper in his 70s than I am in my 60s. So I owe him a lot. And you might say that he was about the 4th generation of sanitary engineers at MIT. This is a picture of us working together on wastewater innovations in São Paulo, Brazil. Fast forward about 8 years after that shot, this is me at a 2nd International Women in Water Conference. Between my work with Professor Harleman and this experience, I worked for about a decade in megacity wastewater projects in places like Mexico City, Benares, São Paulo, Brazil, Rio de Janeiro, Beijing, Hong Kong. And those were huge cities and huge wastewater challenges. But I always wanted to be working with the poorest of the poor. And I had my first opportunity to sort of shift my career from large-scale megacity wastewater projects to small-scale rural drinking water projects as a result of this Women in Water conference. Uniquely, it was the first and only conference I've ever been to where the organizers of the conference, which are actually behind my right elbow in that picture, who were educated women from Kathmandu, who brought together women from their country who in 1998 and still are largely illiterate peasant women. About 75% of women were illiterate in 1998 in Nepal. And rather than just inviting the elite, the educated, to the conference, the organizers brought together women from all walks of life. And some of the women had actually walked 2 and 3 days to attend the conference because their children had waterborne diseases and were sick or dying, and they wanted to learn how to take care of their children. And I was invited as a special guest because I was a woman engineer, which in 1998, there weren't none of us, but as far as women engineers working in development around the world, there were very few of us. And so they found me and they brought me there, and I had no idea what I was getting into because at that stage, I had a decade of experience designing and demonstrating innovations in megacity wastewater for, like, let's say Mexico City, population 20 million people. And so I knew how to design and demonstrate and pilot huge wastewater treatment systems, but I had no idea how to apply that at the very most basic, simple, small scale. And the women at this conference, some of these peasant women came to me and said, how do I take care of my children? And I was I was dumbfounded. I couldn't answer, even though I was this, hotshot engineer, supposedly from MIT, who, worked in international contexts. I had no idea how to take the principles of water and wastewater treatment and apply them at this scale. And I said to the women, I don't know, but I commit to working with you on this problem, and I will come back. And so that's what I did. I was able to organize the first team of MIT students to come back to Nepal in 1999. And I'm working there to this day, all right? And it's a small country, 25 million people or so, but huge water problems. And I thought, if in my lifetime I can only just work in Nepal and make a contribution here, then I will have done something. Life didn't sort of play out that way. That's a longer story. There was civil unrest in Nepal. I couldn't take students to civil unrest countries after 2005, but I did work there for 7 years up till 2005 and came back after 2011. So I learned about the need for safe and accessible water at the rural and small scale from women like these and others. And fast forward, that was 1998, 1999, 2000. The Millennial Development Goals were just coming into effect into the year 2000. It's before your time possibly, but I just think it's important to know that a precursor to the Sustainable Development Goals were the Millennial Development Goals. There were 8: to eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality and empowerment of women, reduce child mortality, improve maternal health, combat HIV, AIDS, malaria, and other diseases, ensure environmental sustainability, and to develop a global partnership. And it's the 7th goal, the ensure environmental sustainability, that has as its target to have by 2015 the proportion of people without sustainable access to safe drinking water and basic sanitation. And so this was the frame around which my work in those decades and still sort of was within that frame. And at the time, there were about 1 billion people lacking so-called safe drinking water and basic sanitation. And as you can see from this slide, under the 15-year Millennial Development Goal period, which lasted from 2000 to 2015, sustainable access to safe drinking water was defined by whether or not the water was improved or unimproved, as it shows on the left-hand column and the right-hand column. And so that was like a surrogate for safety, all right? So that's how it was measured and how someone from within the country would do a survey they'd go around with a clipboard and then they'd be able to check off boxes. Is it a public tap? Is it a household connection? Is it a surface water? And so it was the type of water supply and the infrastructure surrounding it that was the simple way that all the countries of the world could keep common data. And cognizant of these UN stats, I kind of went home from that Women in Water conference, and I set up a focus to my work, which I called Safe Water for 1 Billion People, because that was the estimate then of how many people in the world lacked so-called improved and unimproved safe water. So then we fast forward into the Sustainable Development Goal period, and the new indicator is population using safely managed drinking water. And we've already covered how many people lack that, but that's the new indicator. And we've covered that. So I kind of redefined my work in this Sustainable Development Goal period to save water for 2 billion people, or 2.5 billion people. And, it was a little discouraging in a sense, because I'd worked hard for over a decade and, done my small part. And yet it seemed as though because the indicators themselves were being redefined, we were going backwards rather than forwards. So much of my work and that of my students is at the grassroots with poor communities. It seems small compared to the magnitude of the challenge, and I felt like I dreamed big, but had only accomplished a very small amount. Just to take a few examples, I've worked for many years. After Nepal had its civil unrest, I found myself in West Africa in northern Ghana, and I helped to build a factory there, and I've taken students, probably over 100 students, in teams of between 8 and 10 for many years to this site in northern Ghana. So here's John Mayer, training unemployed young men in the community to build public toilets. And some of the public toilets we've built in villages that have heretofore practiced open defecation. My students and I have constructed this ceramic pot filter factory, and we've also conducted trainings and demonstrations on how to use the various technologies. We've contributed to the eradication of guinea worm in northern Ghana, in Ghana, throughout Ghana, because of the filters, the Africa filters that we manufacture. The guinea worm campaign had distributed thousands, even maybe millions of cloth filters, but it was only after they combined the cloth filters with our ceramic filters that guinea worm was actually able to be eradicated. So recently I decided to add all this up, and I was pleasantly surprised. And it occurred to me that I had mentored and helped to foster the careers of countless students. And some of them, the first one of which, Nat, had actually done the counting of how many people he had impacted. And I'll show you his numbers in a minute. But many of my students have gone on to impact a number of people. And this is the count, okay? This is a short summary. But I'm going to share with you some of the careers of some of these students, as well as my own impact. And it's not 2 billion, folks, but it's 70 million, and that's where we stand today, based on rough estimates, very rough estimates. So, so I'm going to tell you about 6 or 7 of these kind of high impact students. And many more stories could be told, but these are just a handful of them. So Kate was my student in '09, and she founded an NGO called Saha Global. Originally it was called Community Water Solutions, and they trained village women in Ghana to build simple 3-step community water treatment facilities, which is, the 3 steps are comprised of coagulation with alum, settling, and then chlorination with a chlorine tablet. So the women are trained to do this very simple 3-step process, and then they sell the water in 20-liter jerry can units to the community. And there have been, Kate's established 246 businesses, trained 700 entrepreneurs, and served about 100,000 people so far. Kathy was a Harvard student. Students from Harvard and Brandeis and Wellesley and other area schools are free to cross-register at MIT classes. And Kathy came to me in her sophomore year. She founded Spouts of Water as a student project in one of my classes. And then after Harvard graduation, she got a grant to go live in Uganda for 2 years and build her business. After 2 years, she moved on to a dual degree at Stanford Business School and medicine, where she is today. And in fact, another former student of mine is the director of the organization today, Barika. The impact of Spouts is that they've sold 56,000 filters and all these other achievements as shown in this slide. And this is what their water filter looks like. I should say that Kathy visited my factory, which is called Pure Home Water in northern Ghana, to get inspiration for her very impressive factory in Uganda. And the Spouts program works with schools and refugees and communities as well. They have a nonprofit part of the organization and a for-profit part. This is Nat. He joined the World Bank on graduation, worked for Charity Water in New York, and then transitioned to Safe Water Network, also in New York. He's the VP of Strategic Partnerships today. In the other picture on the right, he's in the white cap, baseball cap in the very back. That was during his World Bank years. He was the chief of water and sanitation in Tanzania, the country director, I guess you'd say, at the World Bank. And these were, so his counting up how many people he impacted was the inspiration for me to try to do that with my own work and some of my students' work. And he sent me this a few years ago, having impacted, he thought, 3.6 million people. And I asked him to update that for this talk, and he has updated it to 4.1 million today. Tommy Ngai is a Canadian, yay, from Toronto, originally from China, immigrated with his family when he was a young teenager. And on graduation from MIT in the Masters of Engineering program as my student, he worked at COST, which is in Alberta. It stands for the Center for Affordable Water and Sanitation Technologies. For 18 years, he was the technical director of COST. And he says, that through the cost work that he's done, he estimates that 10 million people impacted is a justifiable estimate. And then in 2020, about 6 months ago, he transitioned to being the head of water sanitation and hygiene at WaterAid in the UK. He and I, by amazing coincidence, were both in Nepal in January 2019, and we had a chance to revisit an arsenic remediation effort that he and I were instrumental in making happen. And amazingly, we revisited an entrepreneur. We had identified arsenic in Nepal. We had designed various possible interventions. We had piloted those interventions. And I should say we worked closely then and still with an organization called Environment and Public Health Organization. And Tommy had trained entrepreneurs, including in the background of the middle picture is Narayan Pandey. And he was one of Tommy's favorite entrepreneurs. And so in a weekend trip, we flew down to southern Nepal to revisit these arsenic sites where Tommy had worked for 4 years, and where I and my students had also worked over a period of years. But Tommy worked there full time, whereas I would come in January and June in that period of time. And what's amazing is that this house in the middle was the site of a mud brick hut where Narayan Pandey began his enterprise. He had 4 young children and no vehicle. And today he's the richest man in the village. And I got to see various households like that on the right of satisfied customers of his Lumbini filter enterprises. So our arsenic filter has had a huge impact on arsenic in southern Nepal, in those districts that are arsenic affected. And Tommy's comments about his job today is that he's leading a team of 15 specialists in designing programs around COVID. And that at WaterAid, they've been able to impact 99 million people with hygiene messages as part of the COVID response. So we didn't throw those numbers into the tally just because how do you take credit for an organization's work? But that's really super important work that Tommy's doing at cost and still. And then Robert Baffrey is an example of a wastewater engineer who I worked with. And today he's the head of the operations of wastewater services at Manila Water Company. He does construction and operation of new facilities and various programs to provide healthy water and sanitation services to people. and Pratika DUSP is the Department of Urban Studies and Planning. And she took my course in 2010, and she rang me up at the time of the outbreak of COVID, because in her capacity as the director of research of an organization that she established called IDFC, she had a contract from, I think, the local government of Mumbai to set up an emergency response in the slums of Mumbai, population 7.8 million people. They needed to encourage hand washing to prevent the spread of COVID. And so she wanted, so we set up a Zoom call with with people from who were experts in slum services, and with some medical doctors from the University of Chicago, and myself and Tommy Ngai joined that call. And we came up with a really simple solution for hand washing that everybody could probably manage. It was a 2-bucket solution with clean water and hand washing with soap in the first bucket, and then bleach in the second, a designated amount of bleach in a scoop in each of the 2 buckets. And there's a video here. We don't have time to look at it, but perhaps you can look at it. Basically, it's one of the residents of the slum demonstrating in that slum how to use this 2-bucket solution. So that's a impressive effort that's impacting a large number of people. And finally, Zhao Yuan or Charlene Ren was a student of mine in 2015 through 2017. And she founded an organization called My H2O, which is extending clean water access in China. For her work, she's won various awards and prizes. She got the idea for this organization as a term project in one of my classes. She's been named one of the 30 under 30 honorees by Forbes magazine. And she's expanded her work into 23 provinces, has these various NGO and student groups reaching over 1,000 villages today. And they do water testing, and they provide technical support for water interventions. So I'm on time, having gotten in under the hour, leaving some time for your questions. To sum up, reimagining engineering in service to vulnerable people is a worthy enterprise and career choice. It's easy for us to imagine in the time of COVID, the service and dedication of health professionals. I believe that engineers, like health professionals, need to dedicate their lives to the service of others. And so I invite you all to study hard and as much as you can in multiple disciplines that are required to take on the gargantuan and heroic endeavor at the interface of human and planetary health, and to join us as soon as possible, because we need all the help we can get given this wild world that we're living in today. So thank you for listening. Thank you for having me. And I welcome comments and questions and your thoughts. Take care. That's it.
Okay, thank you so much.